extension, internal, external rotation, and then there's also a seated hip internal, external rotation, which I think is much easier than the prone, but we'll show you both.
But we'll have a pick.
You can pick.
Okay.
If we show you multiple ways, you get to pick whichever is most beneficial, most comfortable to you. So for hip flexion, I'm gonna come over here. I just want you guys to see setup. You're gonna drape to expose greater trochanter. That's gonna be your fulcrum. Stationary arm is gonna be midline of the pelvis, so kind of in between ASIS and PSIS. Will be stationary arm. Moving arm is down along the femur, pointed towards that lateral femoral condyle. Good. Normal hip flexion is 130, 20.
One of the sources says like 135, which I find to be fairly uncommon. So I would think of 120 for hip flexion.
So we'll say 120. If you say 135 and can cite the source, you'll get the points. But we're gonna say 120. So the table is actually gonna be doing most of the stabilization for the patient. You do wanna make sure that they're not going into a whole lot of posterior pelvic tilt and you're not rotating them away. This you are allowed to let the knee bend because you don't want the hamstring to be the limiting factor. We'll get to hamstring MLT later, but for Goni, knee does get to bend. So first, setup, I'm gonna palpate my landmarks. I have them exposed. I want you to breathe. Nope, too helpful. Just relax. Push. Ask your patient if they have knee problems. If you have your hand pushing on the outside of the knee or under the knee, just if they have knee problems, you don't want to be cranking down on that knee super hard. And this will probably be a soft end feel. Some people it might be firm depending on body size and structure, but just know it's probably a soft end feel. Any pain? So look in here. To me, that looks like it is about, I'll say 130. Any pain? All right.
This was stopping though.
No, I'm sorry.
A lot of your total hip patients, after you're cleared to go through bigger ranges of motion, they'll be tight muscularly.
Yes.
So that would be a situation you would definitely get like a firm end feel, but again, that wouldn't be normal at that point. So.
Okay. And I have her at 132.